with Dr. Scott Eshowsky from Beacon Health. And really, Scott, I would like to hear your perspective on how did you approach building a financial ROI case for expansion into 6 new facilities. I know you've used EndoTool at one facility for a number of years, and trying to persuade your group to move forward with that expansion. What resonated with leadership, and what metrics were the most compelling to leadership?
Sure. Thank you, Paul. So we, like you mentioned, we had been using EndoTool at one of our hospitals for quite a number of years and had been able to collect some impressive data, especially as it relates to minimizing, if not eliminating, a majority of our episodes of severe hypoglycemia in patients on insulin infusions. And so when we were looking at comparative data at our other hospitals, we realized that there were still, it was a more frequent event than we wanted to acknowledge, that we still had episodes of severe hypoglycemia. And when we looked at those admissions, realized that a patient with an episode of severe hypoglycemia compared with a patient who is admitted for a similar diagnosis ended up having on average an extra 5 days of length of stay. And so we thought that if we would be able to roll out EndoTool at the other hospitals and essentially eliminate or minimize those episodes of severe hypoglycemia and eliminate those added days per admission, we would actually, based on the volume that we have at those hospitals, we would open ourselves up to a capacity of an additional 82 inpatient admissions. And that obviously translated into a pretty significant potential ROI for us. And we happen to be in a situation where we frequently have patients boarding in our emergency department, and sometimes have had to divert patients away because we simply don't have room to accept a transfer. And so our thought was, this would be a really good opportunity for us to open up some additional capacity to reduce some of our ER boarding and to be able to accept more of those admissions that were transfers from other health systems.
Well, that's a very compelling and impressive argument. Were there any other objectives or concerns you needed to address with senior leadership to make this investment?
You know, not necessarily. That potential ROI spoke pretty loudly. The other thing that really resonated is just simply the obvious patient safety component of avoiding severe hypoglycemia. You know, those episodes of severe hypoglycemia tend to lead to sometimes catastrophic health outcomes. And so knowing that those things were occurring in our hospitals and not occurring in the hospital that had been using EndoTool really resonated, even with the non-clinicians and our administrative leadership, who basically asked the question of, why haven't we done this sooner? And so from a safety perspective, a quality perspective, and a financial perspective, it became a pretty easy conversation to have once we had that data.
Yeah, there are a number of ways to quantify the financial benefits of using an application such as EndoTool. There's been a study in the past where they looked at patients that did have a severe hypoglycemic event versus those that did not, and there was on average about a 20% reduction or 20% increase in the cost of the hospitalizations for those patients that did have a hypoglycemic event, which does correlate well with you. We've seen other of our clients that have also made very compelling cases for expansion and adoption. On the next slide, you'll see there were two institutions that looked at patients that were treated with EndoTool and without EndoTool. If we could move to the next slide, please. In Corewell Health, they looked at their use of EndoTool with treating DKA patients, and in that case, they saw about a $1,200 savings per case in those patients, and this was based on the Vizient database, where Vizient will look at patient comorbidities and predict how long they should be in the hospital and what the cost of care should be, and they saved about, again, $1,200 and about half a day length of stay. And we saw similar outcomes in Atrium Health, where they compared both two populations, those treated without Endotool and those treated with, and there was approximately half a day length of stay reduction, and also a $12 million savings across all those cases. We also have a very nice ROI tool that takes into account a number of factors that occur with reduction in severe hypoglycemic events, in terms of the cost of those events, the increased length of stay, and just the cost of additional glucose testings that are often needed without Endotool. And we have a very nice ROI tool that we would love to share with you. You see on the next slide, there's an option to register to receive that tool, and we'd be happy to share that with you.